This is certainly an honor, and as you said, very timely uh, talk for all of us. And I'm just very proud to have Dr. Elliott Sherrill to co-present at this time, because so much of the problems that we're seeing now and will see in the future because of stress related to COVID and the other ancillary diseases will involve mental health. So we know that there's been much in the news about institutional racism and 400 years, and really how COVID has uncovered really the problems of health disparities in our communities. And this simply shows that in our nation's capital, that 46% of the population is African American, but 76% of the COVID deaths are African Americans. And by the same token, with the opioid epidemic, we saw that approximately 80 to 84% of the overdose deaths in the district were African Americans. So when we look nationally, we see that as of May 30th, 48% of the cases and 54% of the deaths are in 22% of counties that are disproportionately Black. And those are showing up on the map in the blue. So before COVID, we were well aware of health disparities, particularly in communities of color. And this is a report that I just wanted to show you that came out in the last couple of weeks from Georgetown University in detail on the health disparities in the District of Columbia. And it's not surprising when we look at these health disparities that we see that there's a marked difference in life expectancy. If you note on the west side, Ward 1, 80.9 years, Ward 2, 85.3, 87.6. And then when we look at Ward 7 and 8, we can see that there's about a 15-year difference. So the other issue that the district has been noted to be the fastest gentrifying city, large city in the country. And this has been going on for some time. So again, we see this east-west movement, and the folks on the east side are getting poorer and poorer as time goes on. So when we look at these disparities, they don't just stop with healthcare. Also food services, pharmaceutical services, medical services are all part of that. And this certainly leads to anxiety and depression that subsequently ends with hopelessness, helplessness, low self-esteem, projected anger, and that anger is often manifested as violence or self-medication. So in the age of COVID, 2020, we're seeing an exacerbation of that. So when we look at patients who already have underlying diseases, we're seeing that in these patient populations that patients are dying at 12 times the rate in poor communities. And this slide just shows the rate of hospitalizations as well as deaths. And again, we see that African Americans are about 11 or 12% of the population, but 22% of the confirmed cases of COVID. And when we see by age, the distribution on the right-hand side. So recently, the District of Columbia surpassed 500 coronavirus cases, and 3 out of 4 have been African American. So when we look at this map, the darker blue shows areas that are predominantly uh, uh, residents of color, and we can see the difference on the east side and west side, and that goes into Prince George's County. But this really exposes the marked differences in how the coronavirus exposes us to health disparities. And of course, those are the areas where most of the deaths are occurring. So this shows really the diseases that we're talking about, primarily chronic obstructive lung disease, asthma, hypertension, and I'm not going to go through all of these, but we can see lower income, uh, 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 more areas are more prevalent in deaths, whereas higher incomes are less prevalent in deaths. And that plays out for each one of the chronic diseases demonstrated. And we can see, again, the District of Columbia has been highlighted for chronic pulmonary diseases, but of course, all of those diseases are more prevalent, whether it's hypertension, diabetes, obesity, kidney disease in communities of color. So there's structural factors also that play into this. So healthcare access, density of households, multi-generational households, employment status, pervasive discrimination, disinformation. Many of our people were talking about the fact that African Americans could not get COVID. Anxiety, depression, isolation, and of course PTSD. So these are what we call the social determinants of health. And this is an article in the Washington Post that references a study done by Janice Blanchard and others at George Washington University. These were emergency room doctors really showing what they were seeing as the impact of the social determinants of health. Where you live, who you live with, transportation issues, income, etc., all play into outcomes. And they were seeing this manifested in their emergency room. So this slide really shows how COVID has impacted the community. So that green line shows the expected death rate comparing 2019 to 2020. The red line shows the actual death rate. So we see this bump starting in mid-March at representing COVID deaths. And then the yellow line actually shows what are called excess deaths. So these are folks who died not because of COVID, but because people were afraid to go to the hospital. They were afraid to go to their physician. They were afraid to or unable to keep up with their medications. And of course, we know that many people lost their jobs during this time. So that 78% of the deaths in the District of Columbia in this peak were related to COVID, but there 22% of the deaths were related to inability to actually access health care. And we see that there was a 42% drop in emergency room visits starting with COVID. So the next factor is the opioid epidemic. The opioid epidemic did not go away because COVID came in. So the District of Columbia and African American communities across the country were suffering from opioids at an accelerated rate, although it was not generally reported in the news. Many people thought that the opioid epidemic was a white, suburban, and rural phenomenon, when actually starting in about 2015, as you can see, that fentanyl entered the heroin market and actually exacerbated that problem. This was an article from the Washington Post in 2018 showing how far behind we were in terms of really addressing the opioid problem. And we did a study at Howard University about 5 years ago on a group of my patients, showing that 42% of those patients needed or access to mental health services. And we also see that housing was a major problem. So in my practice, anywhere from 16 to 50% of the patients have housing issues, either homeless on the street or having difficulty because they're living with relatives or friends. So we see that housing becomes a very critical component. The other part is the revolving door of incarceration as treatment, which has been with the African American community for over 50 years. So nonviolent substance abusers and people with mental illness frequently ended up in the prison system. So we could actually save money by treating them. And this is an article written by Dr. Leanna Wynn, the former Commissioner of Health in Baltimore, really showing how treatment of addictions actually saves money. So this is just a profile of my patient population, and you can see that the bulk of the patients are between the ages of 59 and 69. But I actually have two patients who are now 80 years old. 80% are compliant, meaning that they're opioid free on any given day, which when you look at just from the criminal justice system, saves about $8 million either in criminal activity or incarceration. So when you add opioids to COVID, we're now having a double issue. And this was predicted that there would be an increase in opioid overdoses because of the isolation. Addiction is a disease of isolation and loneliness. So already we're seeing an uptick even before COVID. By the end of 2019, the district had matched its previous high with 281 deaths. And actually in January, there were 41 deaths. So when we look at this graph, we can see that in 2017, there was a peak, then a dip, and then that peak was matched in 2019. And looking at recent statistics from the Chief Medical Examiner's Office, at the current rate, starting in March and April, we will reach 430 deaths, which would be 60 deaths per 100,000, which would put us either #1 in the country in opioid overdoses. So we can see how the COVID epidemic has already impacted this, the overdoses in the district. Many of those overdoses are in the 60 to 69 age group and the homeless population. So one of the problems that we have is a lack of compassion or empathy in compared to COVID patients. And this was part of the problem in the slow response and continuing slow response in the District of Columbia, is that these patients were really overlooked in terms of treatment. Even Narcan was not was resisted to be distributed by the police department, as opposed to COVID victims are looked upon more favorably by the community with less stigma. So this, again, this was the brother of one of my patients who had been incarcerated and subsequently released and overdosed and died in Southeast Washington. And again, treatment was not provided, although the impact on families is the same. So we can see that there's a tremendous impact of COVID and opioids and now with the death of George Floyd and the other deaths from police brutality, that our community has really suffered. And this is a slide that actually shows that after the death of George Floyd, that depression and anxiety were impacted almost immediately within weeks across the communities, even though we didn't know the persons involved. These diseases are impacting everybody, whether you know a victim or not. So this was a talk that I gave a couple of months ago at the O'Neill Institute at Georgetown University on the impact of addiction, mental health, race, class, and sex. And this was to a law school class. But we can see that compassion and empathy or conscience can vary widely based on race, view of how we view gentrification, how we view one's addiction or substance use, age, class, sex, and the economics of COVID, with people losing their jobs, and of course, police brutality. So we're seeing this tremendous outpouring of all races, all ages, which is where I see hope. The fact that for years we didn't understand what the kneeling of the football players meant, but now it's all coming to a head, and we're really understanding that Colin Kaepernick was really ahead of his time. He was really sacrificing for all of us, and we now know that this impacts everybody, and it's inescapable. So this is just a quote from Dr. Martin Luther King over 50 years ago, really telling us how we're all tied together. So when we look at this issue, and especially now with the demonstrations that we're seeing in the streets and all around, that we have to be very careful, even in our wanting to express ourselves in public, that the virus is still out there, and we still have to be careful and protect ourselves by social distancing, wearing masks, washing our hands frequently, and protecting one another. So this is an article that was written by Robert Hay from the Medical Society, and these are some of the issues that we've had in the medical community for the past 20 years. The physician brain drain with hospitals closing, the stress of services on the east side of the city, the need for malpractice reform, and Medicaid reimbursement has actually driven many physicians out of the city. So when we look at this, there was an article written by Professor Lawrence Gostin from the Georgetown Law School, the director of the O'Neill Institute, and these are his criteria for equity healthcare. So equity healthcare goes far beyond the 98% insurance coverage. You have to have all of these factors, meaning that the services have to be high quality, they have to be accessible, they have to be cost effective, and of course, the social determinants of health, where you live, education, transportation, etc., all plays into those outcomes. So this was a surprising article actually written in the Washington Post. It's owned by Jeff Bezos. But when we talk about conscience, this article 2 weeks ago, June 4th, actually showed that the 50 top billionaires in the country have only contributed about $1 billion, which is 0.1% to the COVID epidemic, in spite of all of these deaths that we're seeing. This is the Mayor's Commission on health equity. And to be honest with you, just the sight of the fact that many of the ideas that have been brought out by this group are rehashed old ideas. And so me as a physician, I had my period of not being able to breathe because we need a change. We don't need to go backwards. We need people who are really sincere about making those changes. And we, as a medical community, are going to have to react, not like the young folks, particularly on the street demonstrating, but in order to stop the brain drain and exodus of physicians from the city, we're going to have to do the right thing. And that means that we're going to have to wake up. And as Spike Lee has told us years ago. So if white silence kills, medical science also kills. And I'm going to let Dr. Sorrell tell us from a mental health standpoint how we can raise the conscience of our community. And thank you so much.
And it is my pleasure now to bring up to the stage MSDC past president, Dr. Elliot Sorrell, who should be unmuted now, and his slides are setting up right now. So Dr. Sorrell, take it away when you're ready.
Thank you very much, Robert. And thank you very much, Dr. Chapman, for taking this initiative and inviting me to partner with you on this very important and historic moment in our city's history and in our country's history. I also want to thank Robert and Pia, and especially our president, Dr. Pineda, for welcoming me back home. For me, it's like coming back home as a former president. It gives me great pleasure to serve again what is best in the medical societies, that is to serve the District of Columbia. It is in that spirit that I want to share with you that my presentation will not be limited just to mental health. You should know one detail about me, that is, I am a psychiatrist, but I think of myself first as a physician and second as a psychiatrist, and I'm interested passionately about it in the integration of care, not the siloed of care. So with that in mind, we'll proceed to my presentation. Frederick Douglass in about 1886 stated that where justice is denied, where poverty is enforced, where ignorance prevails, and where any one class is made to feel that society is together and in conspiracy to oppress, to rob, and degrade them, neither person nor property will be safe. That was stated more than 130 years ago, and it still holds true. Now, Reverend Alfred Sharpton, referring to Mr. George Floyd, said, God took the rejected stone and made him the cornerstone of a movement that is going to change the whole wide world. And indeed, what happened in Minneapolis has energized not only the United States, but people around the world to stand up and fight for long-standing injustice across the world, including the United States. Now, in a recent opinion editorial, E.J. Dion wrote just a few days ago that a single traumatic event can change minds, move consciences, and galvanize a nation. And he gave a concrete example that 5 months after Bloody Sunday of August 6, 1965, President Lyndon Johnson signed the Voting Rights Act into law. Keep in mind that there will be about 5 months from the time that Mr. Floyd was buried in Houston and our election in November. Perhaps this 5 months reference may be quite relevant to how people will behave in November and the changes that we may want to bring about. Now, racism and discrimination is one of the major social determinants of health in the United States and globally. In our country, an unfortunate legacy of 246 years of slavery, 400 years of racism and oppression, lynchings and incarcerations, and continued discrimination into the 21st century. At the time that slavery was abolished, there were promises made, and there were many promises made to the Native Americans as well. The promise that was made was 40 acres in the mule for the then 4 million people that were there. Promised by Special Order number 15 in 1865 by General Sherman, that was immediately, almost shortly thereafter, broken by President Andrew Jackson. And then, of course, multiple land treaties between the United States and the First Nations made and subsequently broken. Now, I thought that we should think for a moment, what does that mean in terms of economics? How does this translate forward? 246 years of legal slavery, 4 million African American enslaved, 13% of the total population. If we calculate, and economists have done a calculation, 4 acres in a mule, that value in 2020 would be about $6.4 trillion. Now, it was really on the back of the slaves that America's wealth developed. Slavery launched essentially modern capitalism, making the US the wealthiest nation in the world. Emancipation regrettably did not bring economic freedom to former slaves. Racist and discriminatory policies against African Americans continued, and none of them were able, not very few of them were able to establish and grow wealth. And economists have calculated again, right now in the United States of America, African Americans on an aggregate, they are compensated 59 cents to the dollar that whites get compensated for their work. This is an aggregate. Excuse me, Robert, stay one moment back. And the accumulated wage disparity is huge. For every dollar of accumulated wealth by whites, blacks have just 10 cents. So the disparity continues in extraordinary ways. Now, I'd like to move now into that to complement the excellent presentation that Dr. Chapman did about the disparities in health. And these are staggering numbers that have existed not just since the death of Mr. Floyd. This has existed for decades and decades and decades that we have done nothing, either in the public health arena, in the primary care arena, at the policy level, in any of those arenas. Maternal mortality, total maternal death per 1,000 live births. All US mothers, 14. African Americans, 43.5. Scandalous. Infant mortality, all US mothers, 6 per 1,000 live births. US and African American mothers, double, or nearly 12. Now, in terms of the major non-communicable diseases, how they affect African Americans and makes them more vulnerable to the ravages of COVID, diabetes, 60% more common than among Caucasians, 2.5 times more likely to suffer limb amputations, 5.6 times more likely to suffer kidney disease, hypertension in African Americans age 20 plus. Men, 42% higher prevalence than Caucasians. In women, please note here also a gender difference. Women, 45% higher prevalence than Caucasian women. And strokes kill 4 times more 35 to 54-year-old adults, African American. Asthma, 3 times more likely to die than Caucasians. Cancer, men 40% higher than Caucasians, and in women, 20% higher. Now, death due to COVID, that's also, of course, a story of disparity. Death due to COVID per 100,000, 50.3% for African Americans, Latinos 22.9%, Asian Americans 22.7%, Caucasians 20.7%. So more than double the rate of Caucasians. Death rates disparities among African Americans and Caucasians. In Washington, D.C., 6 times more likely if you're not African American. In Michigan and Missouri, 5 times. In New York, Illinois, and Louisiana, 3 times. Another tremendous challenge that we need to overcome. Now, in terms of police brutality and mental health, the literature is replete with this problem, both in the legal literature, the medical literature, the mental health literature, and so forth. American police kill more than 300 African Americans every year. Then 25% of these victims are unarmed. 49% of respondents to a 2018 Lancet survey were exposed 1 or more times to killings of African Americans. The largest mental health effect occurred 1 to 2 months after exposure. As indicated by Dr. Chapman correctly, a huge increase in anxiety, depression, and post-traumatic stress disorders. Now, to reflect for a moment, what is all this about? And why is this now? Is this time different than any other time? I believe this time is different than any other time. Dr. Chapman has indicated already the reflection in the demonstrations, who's involved in it. But we need to come to terms in America, and particularly white America, needs to have this process of conscience to realize that African Americans have oppressed for 4 centuries. The discrimination has continued, and it is systemic. It is not just an occasional discrimination. It is systemic, and it affects both health, wealth, and the well-being in life. The police brutality is systemic as well. The murder of George Floyd becomes a catalyst. It's not a solving of the problem, but it is a raising of consciousness event. The pandemic and the economic meltdown, coupled with the murder of Mr. Floyd, has in fact raised the consciousness of all people across ages and across ethnic groups to rise up to ask for change. Now, the revelations are even clear. The COVID has revealed again, if you recall, after Katrina, we had a similar revelation. This is even more revealing with COVID, the health disparities, especially affecting African Americans, and that we have urgent need for solutions and innovation in policies and changes in implementation in the 2020 election. I want to make a brief parenthesis here. The Affordable Care Act that was initiated by an African American president of the United States is the only policy that has addressed to some extent these centuries-old dilemmas. You should know that the quest for health for all Americans started around 1905 during President Theodore Roosevelt, has continued throughout the century, 20th century. And it was only President Obama that succeeded to make a dent in the resistance to achieve health for all Americans. We're not there yet. The Affordable Care Act is a progressive piece of legislation, but an incomplete one. And as you know, it has been brought to be defeated twice before the United States Supreme Court. Unfortunately, it was not defeated. But the Affordable Care Act is appearing now for the third time before the United States Supreme Court this fall. I am happy and proud to inform you that together with a group of 100 other colleagues from around the country, we have submitted what is called an amicus curiae, a Friends of the Court statement indicating what will be the consequences if the court decides this time, the third time, to defeat the Affordable Care Act. Not only that the Affordable Care Act is not complete, but defeating it will create us a major drawback on the whole country. And the numbers that Dr. Chapman and I just showed you are likely to double or triple should the next pandemic occur without the Affordable Care Act.
So Dr. Chapman, while we pull up this information, have you lost any patients in your treatment program from COVID-19?
Amazingly not. I'm not that I know of. I have 270 opioid addicted patients.
First of all, Dr. We have heard a lot about the problem, Dr. Searle and Dr. Chapman. You all have talked about the problems. How do we start to bend the curves tomorrow?
I would say by, first of all, observing the recommendations of Dr. Fauci. I think we need to have a national plan that enforces the recommendations made. If you may recall, some of you may know, there was a research study recently published that indicated that the use of face masks saved tens of millions of deaths in our country. So we need to have an agreement that that decisions should be influenced or directed or decided based on scientific evidence. At the moment, regrettably, it seems to me we are halfway there, 3/4 of the way doing it, and about 1/4 of the way not doing it. We're running a high risk of increasing this pandemic and its resurgence. Until we have a medication and a vaccine, the recommendations made by Dr. Fauci ought to be enforced nationally. I know we have a challenge in America because we have a separation of decision-making between the federal government and the states. But I think the best evidence indicates recommendations made by Dr. Fauci would be one of the things that need to be enforced at the national level with the governor's, of course, collaboration.
I think now is the time for the medical community to stand up. I was so elated to see Robert Hayes' letter several weeks ago that brought up an issue that had not been discussed for at least 20 years, and that was tort reform. It's something that I guess politicians shy away from, especially in the District of Columbia. But just as I pointed out that how little billionaires had contributed to the solution, we also see how selfishness and avarice has actually driven physicians out of the city. So when DC General Hospital closed, around that time, there was still much discussion about tort reform. But then many of my colleagues who were in obstetrics and gynecology started changing their practice or either moving. So now, when you roll the clock forward 20 years, you can see what has happened. We have no obstetrician gynecologists in Ward 7 and 8 in private practice because they can't afford it. And you have to understand that medicine is a business like any other. And you can't afford to pay $200,000 in malpractice insurance. And on the other hand, you're delivering babies primarily with Medicaid insurance that was paying back then maybe 20% of what commercial payers were reimbursing. So they all went out of business. So what does that mean? That means that we have several generations of mothers and children who are not getting the care that they need. That has to stop. So how do we do that? We do what the young people have done with Black Lives Matter and defund the police, whatever you want to call it. Everybody wants to get tied up on the semantics. But the point is that they're saying that spend more money on social services, on housing, on mental health services, addiction services, stop sending people to jail or incarcerating them for addictions and mental illness. They need to go to treatment. And once you change that paradigm, you will save a lot of money. So at the same time, we're going to have to step to the politicians and put it in front of them. They're either going to do it or they need to be voted out. This is an issue that needs to be brought to the table right now, because you need providers in the community, and they're leaving they've left or they're leaving because they can't afford to continue practice. So we have to really stop the hypocrisy and the dancing around the issue. This is a major issue.
Great. Thank you both for wonderful answers. I'm just going to remind the group that we are coming up on our time. So if you have any questions for Dr. Chapman or Dr. Sorrell, please put them in the chat box. There's a really good one in here that I'm going to ask next. And this is, let me read it directly. What makes you believe that this show of concern wants to blow over in the next, let me read that again. What makes you believe that this show of concern will not blow over in the next year and we will go back to the old normal? I don't know, Dr. Chapman, do you want to handle that one first since you handled the last question second?
Sure. The fact that, when I say young people, and I say young people energized and out, how many days? 20 days in a row. We now have Twitter and internet and all these various communications. I really feel the fact that it's the diversity and the fact that they understand the issues and they're serious. That this is about the next generation. This is not about us. We need to listen. This is Bernie Sanders' agenda on steroids. And they're talking about universal health coverage. They're talking about free access to college. And as far as I'm concerned, that's the investment in our future. We should invest in our young people. There should not be any young people who are unable to go to college because they don't have the money. If they have the skills, they should get the education. We have to invest in human capital, and that's what we've not invested in. So I think this is going to go. They got time on their hands because of COVID. It's a strange period. I think COVID has really given folks time to concentrate on what's important. To see food lines is just heartbreaking. So I think it's going to go through to November, and we're going to see some changes, and we're going to see some changes very quickly.
Robert, may I also respond? I'd like to respond. To the gentleman who asked, or the lady who asked the question, what makes me think that this is different? There are a couple of reasons. There are a few. The first and foremost is that this is one of those unique moments in history when you see hundreds of thousands of people fully aware that they may even lose their lives as they involve these demonstrations, but they are demonstrating nevertheless because they have value judgment. Their judgment is more important to bring about the change that is 400 years too late than just continue to be colluding with a system that has been corrupt, that is favoring 1% of the country, that continue to discriminate and obstruct other people's progress. This is an unprecedented moment in our country's history. It gives me renewed hope in our country and in the generation of young people who are contributing to these demonstrations, but also across generations, from the very young and very old. This country's consciousness has been awakened by the police brutality, by the economic and health and financial disparities, and by the injustices that promises have been made to be corrected, but they haven't in 400 years. It's time we do it.
So I know I made a call for last questions, but I will be honest, I think that is probably the best place to end this this part of the conversation. Of course, this will be an ongoing conversation. This is, I don't want to, we are certainly not going to end it here, but we are going to end the webinar here. I want to thank Dr. Chapman and Dr. Sorrell and Dr. Chapman for your participation today and giving such great thoughts on this webinar. It's hard to be a moderator between you two because it's hard to live up to your standards, but you all certainly are experts in your field, and we appreciate you taking your time to talk to everyone on the webinar today. So just a reminder, everybody will receive a nice little follow-up thank you note, and with the link that if you don't mind filling that out when you have a second, we'd appreciate that so we can build more sessions like this and come back next week for our town hall, as well as in 2 weeks for Dr. Frederick and 3 weeks for our opioid use disorder, substance use disorder town hall. Dr. Sorrell, as a past president of MSDC, you get the final word. What's your parting thought that you would like to leave everybody on this webinar?
I would like to take up Dr. Chapman's challenge and say that the Medical Society of the District of Columbia needs to be the lead organization in advocating for health for all in the District of Columbia and work with all the allies you could bring to the table to make sure that we accomplish that in this decade, not later than that.
Great. Thank you so much. And thank you everybody for participating today. Have a great evening.